Joining me today, Dr. Jill from Professional Hearing Solutions, and today we're talking about different types of hearing loss. There's more than just one.
There is, yes. So people think either you hear or you can't hear, and there's really nothing further from the truth. So there's different types of hearing loss depending on what part of the ear is affected. The most common type of hearing loss is sensory neural hearing loss. That's what 90% of people have. But there's also conductive hearing loss, and then there's mixed hearing loss, people who have both types. So when babies get fluid behind their eardrums, that type of hearing loss is called conductive hearing loss. And usually that is the type of hearing loss that can be treated medically. Okay. But 90% of people have sensory neural hearing loss. That hearing loss is the permanent kind, unfortunately, and the damage occurs in your cochlea almost the majority of the time. So that's what we also call the inner ear. And so when people come to see me, I have to diagnose what type of hearing loss they have: conductive, sensory neural, or mixed. The severity of it, is it mild, moderate, severe, profound? And then across the board, you can have different types of severity and even different types of hearing loss depending on what frequencies we're testing. So sometimes you hear low frequencies really well, but the high frequencies are gone. So you may have trouble in background noise. So most people who come to see me have high frequency sensory neural hearing loss. They hear perfectly fine in quiet environments, but if there's any type of background noise, forget it. They just can't understand conversations anymore. So that's what we try to figure out when they come to see me. And of course, earwax, if you've got that, we'll remove that first before we do the hearing test.
There are ways to deal with it, and the first way to do that, get a hold of you. How can people do that?
Yep, give us a call. Right there's our phone number. You can also go online and book an appointment, but we'll start with a full, complete diagnostic hearing test and figure out what you need.